Hello, my dear students. I'm Dr. Vaishali Bharambe, Professor Anatomy. I've been teaching anatomy for more than 25 years and I love it. Today, we're talking about Norma Basalis. Why should you study the normas? You should study the norma because only a student who knows the norma knows the head, face, neck region. With that basic in place, I want to ask you some Viva questions. Come on. What is foramen ovale? One of the commonest questions asked on skull. Show me foramen ovale, what passes through it? Show me foramen spinosum, what passes through it? Show me foramen lacerum. Show me foramen magnum. Okay. Do you know how all these? If you don't, then come, let's begin our study of Norma Basalis part 2. Right. So Norma Basalis essentially is the study of the lower surface of the skull. This is normally the skull. We are studying this part. Okay. That base of the skull gets divided into 3 parts: anterior, middle, and posterior. We've done the anterior as Norma Basalis part 1. Today we are focusing on the middle, which is Norma Basalis part 2, and the next lecture will be Norma Basalis part 3, which is the posterior region of Norma Basalis. So let's focus on the middle part today. Remember, please keep pen and paper. Sometimes I make you write notes. Also, please keep our friend with you. There's no way you can understand the skull without the skull. So please keep the skull handy. Right. Middle region of Norma Basalis. So see those 2 blue lines here? This is the middle region. Okay. And so behind the hard palate, in front of the foramen magnum. This is the part we are going to be talking about. It has a median region and a lateral region. Okay, if you look at the base skull here itself. So this part here is the median area and everything on the side is the lateral area. Okay, keep the skull handy. We'll go for details later. Right. So now I'm going to zoom in on the skull for you to understand better. Orient yourself all the time. These are the alveolar, this is the alveolar margin, posterior nasal spine, the posterior edge of hard palate. Okay, right. So this is the middle region I want you to focus on. In the middle, you can see the Vomer bone. Can you see the Vomer? Okay. You can see that. Please remember that this is a skull that is held upside down. You're looking at it from here. Whereas actually the normal skull is straight like this. So whatever looks superior is actually inferior. If this looks superior to you, and this is the Vomer bone, then this is actually inferior part of Vomer. I won't talk on this some more, it'll get confused. Okay, so here's your Vomer bone. Here's the broad bar of bone in the middle, which is over here. Okay, and then these are the 2 posterior choanae. So when you breathe in air, passes through your nose and emerges out through these 2 holes in your nose. Okay. Now, let's zoom in and understand a little bit more. This is the posterior border of Vomer. This is its inferior border articulating with the hard palate. This is its superior border. Can you see how the Vomer bone is dividing into 2 flaps called alae of Vomer, or also called ala of Vomer? Okay, spreading out, ala of Vomer. And you can see formation of 2 canals, palatino-vaginal canal, Vomero-vaginal canal. I'm not going to discuss these because these are discussed in notes section and are not usually asked to an undergraduate student. So we'll not waste time on this. However, those who are interested can refer to the notes section. So now just understand that Vomer, as it's dividing into these 2 flaps called alae, okay, a part of the sphenoid comes and fits into the gap, forming a joint. You can note that happening here. Forming a joint which is called as shindylesis or a wedge and groove type of joint. This is a kind of a suture. Okay, it's asked in Vivas. It's quite common question. What is shindylesis? Can you give an example? Example of shindylesis is the joint between the ala of Vomer and the rostrum of sphenoid. Okay. Continuing back to the broad bar of bone present here. So what is this broad bar of bone? Understand that the green colored bone is sphenoid. The light blue colored bone is occipital. The sphenoid bone anteriorly meets with the occipital bone posteriorly, and together they form a bone which is the broad bar in the middle. Here there is a joint being formed. Two bones are meeting, right? So there is a joint being formed. The joint is formed between the basisphenoid and the basioccipital. Okay, so this broad bar of bone actually is a joint between the sphenoid bone anteriorly and the occipital bone posteriorly. But you must be wondering, ma'am, I can't see a joint. There is no joint there. This is where you should understand that this was a primary cartilaginous joint between two bones which were separate at one point and have now fused. So what happens when there is a primary cartilaginous joint? If you remember, primary cartilaginous joints are made for allowing of growth. So at that joint, the skull keeps on growing till you reach a point when you no longer need the skull to grow. That's when the two bones fuse together and become one bone. Okay, so this union takes place at 25 years, and the joint is formed because you need the skull to grow to allow for growth of the brain. This is where we are discussing. You will see that the broad bar of bone also shows a little projection called pharyngeal tubercle, to which is attached the upper end of the pharyngeal raphe of pharynx. Okay, it forms a roof of the pharynx, and behind it you will find attachment of two muscles, longus capitis and rectus capitis anterior. Only remember these muscles if you really have a fantastic memory, otherwise feel free to forget it. Just remember your pharyngeal tube, okay? The roof of your pharyngeal tube is formed by this broad bar of bone. Students, if you're enjoying this lecture, do please like, share and subscribe to my channel and hit that bell icon. Students, remember, you need to comment on my lectures, you need to ask me questions, you need to tell me what more you want from me. That's the only way I will get encouraged to make more of these lectures which appear to be highly educational for all of you. If you want more detailed lectures, if you want to see surgical anatomy lectures, diagrams, downloadable notes, then do please visit my website www.vbanatomy.com. Okay, so watch the complete lecture. Part of this video was available on the YouTube. The complete video is available on my website. So do please visit my website for the full lecture. Visit vbanatomy.com to continue learning. Right. So students, we just studied this middle area. Okay. We will now move to this two sides, the lateral areas. Okay. Come. Because you're not able to zoom in on all these skulls, I've taken pictures and put them for you. Okay. Use these images well because they give you a detailed view of the Norma Basalis. Okay, so what is this lateral area made up of? Okay, I want you to focus on this lateral area. See, this is the broad bar of bone. This is the Vomer, which we've already discussed. This lateral area is made up of three structures: the greater wing of sphenoid, the pterygoid plates, and the temporal bone. In the temporal bone itself, I want you to understand which is squamous part of temporal, which is tympanic part of temporal, and which is petrous part of temporal. These are parts of temporal bone. So what are the three areas we want to see? We want to see the greater wing of sphenoid. We want to see the pterygoid plates, which are also part of the sphenoid bone. And we want to study the three parts of temporal bone. Come. Let's first focus on pterygoid processes, where I want you to identify on the skull the pterygoid process and the two pterygoid plates. So I'm going to show you this. Come. Zoom in on this area. Okay, I want you to look at this area on the skull that you have in your hand and then compare that area to the image that you're seeing on the screen. Okay, here is the Vomer for you to get oriented, and on either side of the Vomer, you are seeing the two pterygoid processes. each made up of a medial pterygoid plate and a lateral pterygoid plate. And in between the two pterygoid plates, you can see the pterygoid fossa. Okay, so come. This here is the medial pterygoid plate. So on this skull, I want you to note that there is one lateral pterygoid plate, there is one medial pterygoid plate. Okay, can you see these two pterygoid plates with a gap in between? The gap is the pterygoid fossa. This is the medial pterygoid, this is the lateral pterygoid plate. Okay, the same you will find on the other side as well. And in the middle, you have these two choanae through which you are breathing and the vomer in the middle. Okay, so this is your medial pterygoid plate, which has a medial wall and a lateral wall. Correct? So the medial wall gives attachment to it actually forms the lateral wall of your pharynx. The lateral wall continues down as a fossa called the scaphoid fossa. And together they give attachment to our muscle, the tensor veli palatini muscle. Okay. So here's your spinosphenoid, the auditory tube, basically the Norma Basalis. From all of these, your tensor veli palatini takes origin, descends downwards and forms a palatine aponeurosis which is attached to your hard palate. This tensor veli palatini takes origin from the lateral surface of the medial pterygoid plate and also from the scaphoid fossa. That's why we want to discuss it here. Right. So, here is your medial pterygoid plate, the posterior edge of which now has been marked green in color because it gives attachment to a pharyngobasilar fascia. The lower end of it you can see is forming something like a loop. This loop is called pterygoid hamulus and gives attachment to pterygomandibular raphe, buccinator and superior constrictor. These are all difficult to remember words, okay, but unless you try, you're not going to remember them. Here is an image that might help you. Here's your medial pterygoid plate giving attachment to your tensor veli palatini muscle, 1 over. Here's your pterygoid hamulus, which I told you gave rise to 3 structures, the pterygomandibular raphe, the buccinator muscle, and superior constrictor is not seen in the image, but this image might help you remember these structures. Okay, so medial pterygoid plate medially forms the lateral wall of pharynx, laterally gives attachment to medial pterygoid muscle. Posteriorly, it gives rise to the pharyngobasilar fascia, forms a little hook-like structure called pterygoid hamulus and gives attachment to pterygomandibular raphe, buccinator and superior constrictor muscle. Let's go to the lateral pterygoid plate over here. Okay, so this has again a medial wall and a lateral wall. The medial wall gives attachment to the lateral wall gives attachment to the lateral pterygoid muscle. Medial wall gives attachment to medial pterygoid muscle. Extremely easy. Let's review what we have seen. The lateral pterygoid plate, lateral wall, medial wall. Medial pterygoid plate, medial wall, lateral wall. What do you want to remember about medial wall? Lateral wall of pharynx. Lateral wall, tensor veli palatini muscle. Lateral pterygoid plate, medial wall, medial pterygoid muscle. Lateral wall, lateral pterygoid muscle. And here is your scaphoid fossa, which also gives attachment to tensor veli palatini muscle. Right. So, that was the pterygoid process. Let's now move on to the greater wing of sphenoid. What do you want to see in greater wing of sphenoid? You want to see the infratemporal surface, foramen ovale, foramen spinosum and spine of sphenoid. So what are all this? Now this area has been marked for you. Hold the skull, observe this surface, go to the infratemporal surface over here. Okay, this is your infratemporal surface, anteriorly bound by the inferior orbital fissure, laterally by infratemporal crest. How do you feel the crest? Just run your finger along the side and you will feel an edge at which you turn your finger. That edge is the infratemporal crest. Okay. Medially, the pterygoid process. See, here's your pterygoid process. We just saw the pterygoid process with medial and lateral pterygoid plates. Posteriorly, the temporal bone. This is your temporal bone. So, this is your infratemporal surface, the tip of which is close to the spine of sphenoid. I'll be teaching you spinosphenoid. So, that's the infratemporal surface I want you to focus on. This gives attachment to the upper head of lateral pterygoid. Wait, we just learnt about one head of lateral pterygoid. Which was that? Attached to the lateral plate, lateral pterygoid plate. Come. So, this is the upper head of lateral pterygoid muscle. Where is the lower head? The lower head is attached here to the lateral pterygoid plate. Upper head goes to the infratemporal surface. Lower head gets attached to the lateral pterygoid plate. These are the two heads of the lateral pterygoid muscle. Got it? Upper head, lower head. Right. So now, as you go backwards from the infratemporal surface, you come to a beautiful foramen, the foramen ovale. Okay, so I want you to look at this foramen here. So this is your foramen ovale. It's one of the most commonly asked Viva questions in Norma Basalis. If you don't know foramen ovale, then you're likely going to have a lot of trouble in your Vivas. Okay, can you see the tip of the pencil here? No? Okay, so this is your foramen ovale. And if you come just behind it, you find one more tiny little foramen. This is foramen spinosum. Run your finger behind foramen spinosum. You find a little spine there. I can feel it. That's the spine of sphenoid. These are the three structures we're going to talk about now. So, foramen ovale. Foramen ovale is over here. What passes through it? M-A-L-E. My warning to all of you, do not say male passes through it. Male doesn't pass through it. Male is the fantastic mnemonic you have of structures that pass through it. Most of the time, students in Viva say, what passes through foramen ovale, madam? The answer by the student is male, ma'am. That's not the answer. M for mandibular nerve, A for accessory meningeal artery, L for lesser petrosal nerve, E for emissary vein. M-A-L-E. Now, remember this. Student should know something about each of these. For example, what is mandibular nerve? Whose branch is mandibular nerve? What is it doing passing through foramen ovale in the infratemporal region? And so on. You should be able to discuss the mandibular nerve. Accessory meningeal artery, whose branch is it? Lesser petrosal nerve, whose branch is it? What is it doing passing through foramen ovale? Okay, so you have to be able to discuss these structures, not only enumerate them. Right, we go to foramen spinosum over here. It's a tiny little foramen, not much will be passing through it, right? So whatever is passing through it is M. Middle meningeal artery, meningeal branch of mandibular nerve and vein. Okay, so there's a very sweet story about meningeal branch of mandibular nerve. Sometimes you're in a hurry to leave your room, hostel room. So you come running out, you lock the door. And then you realize, oh, I forgot to close the fan. Or I forgot to leave food for my cat. Okay, so you go back through the window. Right? So that is what meningeal branch of mandibular nerve is. Mandibular nerve comes out of foramen ovale in a big hurry, okay? And then realizes, oh, I forgot to supply the meninges. So what it does is it gives a little branch that passes through the window. Who's the window? Foramen spinosum. Passes through that and supplies the meninges, Baba. Okay, so that's how it goes. Middle meningeal artery, whose branch is it? Middle meningeal branch of? Come on. So that's the kind of answers you are expected to know. You're not just expected to enumerate, you're expected to discuss. That means you not only have to know the structures passing through, but you also have to know a little bit about them. Okay? So these are the commonly asked exam questions, commonly asked Viva questions. Right. Coming further to this little point at the back, which shows you the spinosphenoid. See, look at this. This is the spinosphenoid. You can see it very nicely in the second zoomed in area. What should you know about the spine of sphenoid? Spine of sphenoid gives attachment to two muscles, two ligaments, and is related to two other structures. Which two muscles? Tensor veli palatini, tensor tympani. Both are tensors. Which two ligaments? Sphenomandibular and anterior ligament of malleus. What is it related to? Medially chordotympani and auditory tube. Laterally auriculotemporal nerve. Two muscles, two ligaments, two nerves. That's fine, and just add the auditory tube to it. Okay, these are structures attached and related to the spine of sphenoid. So we just covered some of the most commonly asked Viva questions in Norma Basalis. Foramen ovale, foramen spinosum. Spine is sometimes asked. Ovale and spinosum are non-negotiable. You have to know them thoroughly. Right. You also find here a structure which is called as you also find here a little groove which is called as the sulcus tubae. In this groove, can you see this is the groove. I've marked it here with the help of a green little cone. That's where you find your eustachian tube. Okay, you find the tube that is connecting your middle ear to your pharynx. Okay, it contains the cartilaginous part of the eustachian tube. So sometimes I can ask you questions like what is canaliculus innominatus? That's for you to find out. Students, if you're enjoying this lecture, do please like, share and subscribe to my channel and hit that bell icon. Students, if you want more of such detailed lectures and you want to know about surgical anatomy lectures, maybe draw and label lectures and some downloadable notes, then do please visit my website www.vbanatomy.com. Continuing, we will now move on to the temporal bone. Remember, the temporal bone had three parts to it. Identify the three parts: the squamous, the tympanic, and the petrous part. Come. So again, I've zoomed in, showing you this image because it becomes difficult to understand on this skull here. You can see the images here. This here is the squamous part of temporal bone. This is the tympanic plate, and this here, which is projecting inwards, is the petrous part of temporal bone. So, on the side here, these two edges are the zygomatic bones. Okay, you can see how the zygomatic bone is articulating with the zygomatic process of temporal. The zygomatic process is coming back and is dividing into an anterior root and a posterior root. Come, I'll show you on the screen here. This is the zygomatic process of temporal bone, forming an anterior root and a posterior root, and forming a tubercle at the point where they meet, which is the tubercle of root of zygoma. Here between the anterior and posterior root, you can see the formation of a mandibular fossa. I want you to continue to focus on that region. We've zoomed in a lot on it here. Here is the tubercle of root of zygoma. Why are we mentioning it repeatedly? Because it gives attachment to the lateral ligament of TM joint. Very important ligament from point of view of temporomandibular joint. Coming to mandibular fossa, you can see it's dividing into two parts, an anterior part and a posterior part, separated by a squamo-tympanic fissure. Squamous and tympanic. Squamo-tympanic fissure. What is mandibular fossa? Why is it important? Mandibular fossa is the part where the mandible fits to form the TM joint, temporomandibular joint. It has an anterior part which is articular and a posterior part which is non-articular. The posterior part is formed by the tympanic plate, and actually the condyle of mandible does not articulate with it. The anterior part is deep, and that's where the actual articulation and formation of the joint occurs. So, I want you to take a look at that image again. So, this is the deep part where the actual articulation occurs. This is your tympanic plate, which forms a part of the fossa, but no articulation takes place here. It is non-articular. Got it? What is tubercle of root of zygoma? That's where the lateral ligament of TM joint is attached. Commonly asked question. Right. Let's talk about the squamo-tympanic fissure. Remember, a fissure that separates the squamous part of temporal from the tympanic plate. If you observe, there is a little bit of bone projecting into the fissure. This is petrous temporal bone, which divides the fissure into two parts, a petrosquamous fissure and a petrotympanic fissure. This is discussed but hardly ever actually asked in vivas. Petrotympanic fissure can be sometimes asked as some important structures leave the middle ear through it. What are the structures? The chorotympany nerve and the anterior ligament of malleus. Whereas the anterior tympanic branch of maxillary artery enters into the middle ear through that petrotympanic fissure. For further details, please refer to the notes section. So, some of the commonly asked questions that can be asked to you: what is anterior tympanic artery a branch of? What is chorotympany nerve? When it leaves the middle ear, where is it going? What is its location within the middle ear itself? Whose branch is chorotympany? All these are questions that get asked with Norma Basalis. Right. Let's come to the tympanic part of temporal bone, which is here. Okay. I'm looking at the skull from the side. You can see that this is the tympanic part of temporal bone. Zoom in. Now, this is your external acoustic meatus, and this somewhat quadrangular bone here is the tympanic part of temporal bone. You can see the squamotympanic fissure beautifully here. Okay. So here now you're seeing the C-shaped tympanic part of temporal bone. Okay, you can see how it's forming much of the external acoustic meatus. Okay, it also provides area for attachment to the cartilaginous part of your ear. Okay, continuing, you can see here, this is your styloid process. You will see the overlapping of styloid process by the tympanic part of temporal bone. We now move on to a discussion on the petrous part of temporal bone. Here is the petrous part of temporal bone. These two bones which are projecting inwards, see, those are the petrous temporal bones. These two, where my fingers are now. Okay, these two are the petrous part of temporal bone. Focus on that. You will see that they show presence of a carotid canal at the apex of foramen lacerum. Let's discuss this. This is the apex of petrous temporal, in front of which you can see the foramen lacerum. Why call it lacerum? Because it's lacerated. It has no particular shape to it. It's like a laceration. When you get injured, sometimes you get dragged on the road when you fall. You get this rough-edged wound, right? It looks something like that. It's rough-edged. It doesn't have clean, smooth edges like the carotid canal. Okay, so let's discuss these now. What is foramen lacerum? It's a foramen that gets formed between the posterior edge of sphenoid and the apex of petrous temporal bone. It's normally covered by cartilage and nothing of importance passes through it. Sometimes just the meningeal branch of ascending pharyngeal artery, but it's a large space and is therefore always asked in exams what passes through. You have to say nothing of importance passes through. Here you're seeing a carotid canal. Okay, just remember, carotid canal, you can never look through and through it. If you look at it now also, you cannot go through and through. Like in the foramen ovale, foramen lacerum, you can see through and through. Carotid canal, you cannot see through and through because it's an oblique canal. Okay, it's oblique. So you can't look at it from one end and expect to look at the other end. Okay. Carotid canal, what must be passing through it? Of course, the internal carotid artery along with the sympathetic plexus surrounding it. If it's an artery, it has to be surrounded by sympathetic plexus. Okay, so that's the carotid canal. Passing through it is the internal carotid artery, which goes on to enter inside the cranium and supply much of the brain, along with sympathetic plexus around it. And this bit of bone in front of carotid canal gives attachment to levator veli palatini muscle, a muscle of your soft palate. So students, if you liked this lecture, do please like, share and subscribe to my channel and visit my website vbanatomy.com for more of such lectures. This lecture was Norma Basalis Part 2. The next one is Norma Basalis part 3, when we deal with the last posterior part of Norma Basalis. I'll see you in that lecture. Thank you.